watch the sunrise or a horse running in a field. We have learned through our feelings that there is a right and wrong way to look forward into the future when trying to make choices and decisions. I look forward to teaching you what I have learned. As well, I have a question that I would like to ask you in regards to mental health in the United States of America. Why are depression and anxiety going up in our society? The United States of America is the undisputed leader in mental health in the world, yet we have some of the highest rates of these mental disorders. My opinion is that the less real danger we truly experience in our lives, the more able we are to find other risks that are much less clearly defined and much more difficult to find certainty with. Trying not to get bit by a snake is much simpler than trying to stay perfectly clean from bacteria and viruses the human eye cannot even see without a powerful microscope. This would fit in with why you suffer from OCD and anxiety. According to Abraham Maslow's hierarchy of needs theory, Maslow proposed that motivation is the result of a person's attempt at fulfilling 5 basic needs: physiological, safety, social, self-esteem, and self-actualization. Maslow's hierarchy of needs is a theoretical model of motivation developed to explain why we as human beings do what we do as we move up the scale from various degrees of deficiency of needs. Maslow used the terms physiological, safety, belonging, and love, self-esteem, and self-actualization to describe the pattern through which human motivations generally move. This means that for motivation to occur at the next level, the needs from the previous level must have been satisfied. Furthermore, this theory is basic in being able to understand the needs from the previous level must have been satisfied. This is how drive and motivations correlate with human behavior. Each of these individual levels contains a certain amount of internal sensation that must be met in order for an individual to complete their hierarchy. People don't worry about getting their nails done if they are starving to death. Folks don't really worry about their school grades or careers when trapped in an underground cave. Being worried about death trumps safety and social needs. As we become more secure, moving up the ladder of Maslow's hierarchy, we then lose our most basic fears in life. This causes our brains to just move up the pyramid to another level. Our brains are programmed to find solutions to problems that pose any danger to us. Issues that could be dangerous to us could be grades in school, a boss at work, a relationship issue, or an obsession. It is my opinion this is the reason for the dramatic increase in depression and anxiety in the United States and other developed nations. There is much less black and white danger in developed, safe countries. There are not that many mortal dangers in most communities located in the United States of America. The problem with higher level or first world problems is that there are so many of them. These problems are not black and white or time sensitive. Who knows when it could actually happen? Frequently, there are no expiration dates on these fears. So they just stack up like rocks in a huge pile. So we try to prevent hazards that are unclear, improbable, and may take 20 to 60 years to occur, like death or cancer. Besides wasting your life away worrying about obscure dangers that may never arise, it takes a toll on your mind and body that can be psychologically devastating. Worrying only trains your brain to worry more. Obviously, fear of contamination or body image would not matter at all if you were starving to death or thirsty or running from a grizzly bear. OCD finds the perfect partner for its plan of total brain domination. Fear finds a home with your specific negative core beliefs, environmental triggers, and areas of